The case of the missing Italy pandemic plan. Italy Minister of Health Speranza is under the scrutiny of attorneys of families of COVID victims from the country's first wave. Former Director General of Prevention at the Ministry of Health said a pandemic plan was not done, never updated. Coordinator of the Comitato Tecnico Scientifico, a committee of 24 experts advising the Italian government on the pandemic, said there was no provision for necessary masks, beds to free. The fate of the Italy Minister of Health, Mr. Roberto Speranza, is increasingly uncertain now that the prosecutors of Bergamo and the families of the victims from the first phase of COVID-19 have rebuilt the chain of non-compliance of the ministry on the anti-COVID defenses and what appears to be an alleged non-existent Italy pandemic plan. Reticence, false ideology, omissions, complicity, and false testimony. The picture that emerges from the investigations of the Bergamo prosecutor's office on the massacre in Val Suriana gives a photograph of non-compliance with the chain of command of the Italy Ministry of Health under the responsibility of at least three ministers: Beatrice Lorenzin, Giulia Grillo, and Roberto Speranza. Even the independence of the World Health Organization, WHO, is now being questioned, following the censorship in May 2020 of the report on the management of the first pandemic phase by the Conte government as improvised, chaotic, and creative. The fate of Minister Speranza and the political balance of the Draghi government are now at stake around failing to adapt the pandemic plan and the alleged involvement of the Ministry of Health in the removal of the WHO report. Document rediscovered thanks to the legal team of the relatives of the victims of COVID-19 led by lawyer Consuelo Licati. The pandemic plan approved by the State Regions Conference in 2006 remained in force in Italy until January 25, 2021. The plan was never applied. At the center of this story are public officials in charge of dealing with prevention who did not keep a pandemic plan alive, which, without updates, exercises, staff training, storage of personal protective equipment, and a census of ventilators and beds in intensive therapy, remained a dead letter. Attorney Consuelo Licati explained, "The plan has not been updated with the WHO guidelines of 2013, 2017, 2018. Not even with those of the European Commission of 2005 and 2009. With the decisions of the European Parliament in 2013 and much less with those of the International Health Regulations of 2005. However, in Italy's self-assessment questionnaires sent periodically to the WHO and the EU, crucial documents that we came into possession of, which we filed with the prosecutor in Bergamo, it appeared that our country was prepared for a pandemic emergency. They are false claims. The latest, sent by the Italian government to the WHO on February 4, 2020, also demonstrates the responsibility of the current minister Speranza. The 2006 plan was never implemented by the Scientific Technical Committee. Agostino Miazzo, coordinator of the CTS, the Comitato Tecnico Scientifico, is a committee of 24 experts advising the Italian government on the pandemic, led by National Civil Protection. In an interview with Repubblica on September 5, 2020, admitted that there was no provision for necessary masks, beds to free. Above all, there were no stocks. We had to quickly prepare an anti-COVID plan to be used immediately. But in the minutes of the first meeting of the CTS of February 7, 2020, it was stated that the measures implemented by the Italian government represent, in current conditions, an adequate barrier for our country. Who was to take care of this adequate embankment? The prosecutors of Bergamo, coordinated by the chief prosecutor Antonio Chiappani and by the deputy, Maria Cristina Rota, listened to ministerial leaders, former ministers, members of the CTS, and twice Speranza. Rota, on the Rai 3 report program, said, "When asked who should have done something, but also just sent a document, we were told, who? The ministry. Almost as if there was fear in indicating a name." Rota calls it a reticent attitude and adds a detail. WHO had asked the ministry for vigilance over the work of the prosecutor. "We never wanted to poke our noses into WHO affairs but shed light on that famous report and on the pandemic plan, which is of great interest to the Bergamo prosecutor's office in relation to the events that took place in the Alzano Lombardo hospital." Who took the decision and ran with it? Under observation. Therefore, the general directors of prevention of the Ministry of Health seem finished, who have alternated over the last 10 years, but also the directors of Office Number 5, in charge of updating the pandemic plan. We are talking not only about Ranieri Guerra, general manager of Previn from 2014 to 2017, but also by Giuseppe Ruocco, who preceded him, and Claudio De Mario in office until April of last year, besides the various heads of Office 5, all already heard by the prosecutors. It is, therefore, clear the weight of the double role of the deputy director of WHO, Guerra, investigated for false testimony given to the prosecutors of Bergamo, who boasted in a chat gained by the judiciary with the president of the ISS, Silvio Brusaferro, about having withdrawn the document. He had the document critical of Italy drawn up by the Donkeys of Venice, in order to protect the Ministry of Health from reconstructions which he said were incorrect, of which he tried to protect himself above all. Because of the failure to adapt the national pandemic plan, stopped in 2006, what is first called into question is the work of all the general managers in the prevention of the ministry. This is known by Guerra, and for this reason, he proposed to Brusaferro to review together the report. Both Guerra and Brusaferro would know the alleged involvement of Speranza in this affair, as it seems logical that messages to the minister were sent from their cell phones in those days, messages not to be published without the go-ahead from Parliament. Speranza is also a deputy. It remains to be seen whether Speranza did indeed bless Guerra's initiative to withdraw that report and review it together. On May 11, 2020, a few days before the publication of the report, its curator Francesco Zambon, who has now resigned and sued the WHO, exchanged e-mails with Cristiana Salva, WHO External Relations Manager. Zambon wrote, "Some things cannot be silenced," to which Salva replied, "Knowing the field of action, I see this report as a real media bomb." At the beginning of December, Donato Greco, former Director General of Prevention at the Ministry of Health from 2004 to 2006 and from March 2021 a member of the CTS, said, "I followed the work of the 2006 pandemic plan until its approval in the State Regions Conference. A pandemic plan is a living body and should have been updated periodically. It was not done." Microbiologist Andrea Crisanti, technical consultant of the Bergamo prosecutor's office, will deliver his technical report before the summer, which calls to answer 3 questions. The first on the impact of the non-closure of the Alzano Lombardo Hospital, the second on the possible link between the missing red zone in Val Suriana and the increase in mortality in that area, and the third on the application of the National Pandemic Plan. If it had been applied starting from the first WHO alert of January 5, 2020, would it have reduced deaths? Italy had an influenza pandemic plan, explained Crisanti, and the WHO had given indications that this should be taken as a reference. Other countries have implemented it with positive effects, such as New Zealand. Rebuilding travel. Source: Domani.